Hello and welcome to this masterclass. In this particular class, how to choose the best diet for you, I'm bringing together information from talks that I've given last year at conferences internationally about diets, improving health, mental health, reducing biological age. So yes, there's some of these big things, but if I just was to bring it to a simple question, something I'm asked a lot is, what is the best diet? Specifically, what do I eat? But what I want to do is educate you for the factors that are important in choosing the right diet for you. So at the end of this masterclass, you are on the path and less confused, because sometimes we just get caught up in all of this and we're overwhelmed. And I want you to celebrate food, enjoy food, and understand the benefits of key foods to help you on this journey of finding the right diet for you. So just to let you know what we're going to cover, I am going to talk a little bit about genetics and our environment and how food has changed. I think that's really important for you to understand some of these foundations, and is going to help you with the decisions around food. We're going to talk a bit about calories, which is really important in that sort of weight loss area. The benefits and limitations of certain diets, we'll compare those, and then at the end sort of bringing that together to help you work out what is the right diet for you. So right now we are experiencing increased rates of overweight and obesity, chronic health conditions, type 2 diabetes, metabolic disorders, like cardiovascular disease, neurological conditions like Alzheimer's and dementia. And a lot of these are driven by the food we eat. Now, I'm not saying they are the only cause. There's actually an interaction between our DNA, the food we eat, and our exposures to chemicals and toxins and stresses, and how much we exercise. All of these things come into play. But what I will tell you right now in this modern world is that there is a gene-environment disconnection. We have evolved and adapted over millions of years to live with a certain kind of environment, eating certain foods, moving, etc. And now that has changed. Particularly in the last 50 years, the amount of chemicals and toxins that are added to foods, the use of plastics, things are changing at a rapid rate. And our DNA has not evolved quick enough to be able to tolerate that extra load. And some of us, based on our genetics, are a bit more sensitive to some of these chemicals and toxins, certain food additives, etc. So this is this gene-environment disconnection. Now, if you are one of these people that is suffering with food sensitivities, or you're reacting to things, just know that there's nothing wrong with your DNA and your genes. It is the current world. And you can, once you understand all of this, reduce your exposures, change your diet so that you can live more in connection, determining what you're meant to eat, what lifestyle is best for you so that you can be truly well. And I say all this, you might be here going, I just want to know what's the best diet for me. It's really important for me to mention this so you understand the fundamental shift that has happened with food and our environment, and why so many people are getting sick. Can I move to the next slide? You can think about your DNA like an instruction manual or a recipe book. It is your unique code that codes or instructs to make you uniquely you. So within your DNA or that genetic code, there are genes that are going to mean that you are able to tolerate, lactose or dairy. Some of us might be more sensitive to gluten. That's me. You might need more vitamin D, more folate. But if you don't understand your genetics, it's okay. Of course, you can do DNA testing. A lot of people see me for that for one-on-ones. But sometimes I think we just need to sit back and think about, what foods actually make us feel good. What are we reacting to? What's giving us energy? What's making us tired? Just being aware of the foods we eat, because genetically, you will be more inclined to do well on particular types of foods and diets. So every single cell in your body that has a nucleus is literally, a little bit in the middle of the cell that holds the DNA. And in that DNA is the instructions to make you, as I said. So the DNA codes for everything from, your physical traits, so your eye color, your hair color, it affects your height, it affects your risk of certain, diseases, where we actually hold our weight. Some of us are better at putting on weight. Some of us will put on weight on our hips. Some of us will have bigger breasts. These are all influenced by our DNA, the code that makes you, you. But it's not just our DNA. It's our genes and our environment, and that really includes nutrition as well. The food you eat is a huge factor when we're talking about environmental factors. So the genes plus the food you eat, the exposures, the environment around you is what influences your phenotype. So your phenotype is what you're expressing. And what you're expressing right now can actually change. So if right now you're listening to this webinar and you do have high blood glucose, you're on the way to type 2 diabetes, you can't change your genes. You've probably got some genes, one that links with getting zinc into the pancreas, which is needed to make insulin. We know there's a genetic variation that some of us inherit. And I could reel off a few other genes that increase risk of type 2 diabetes or blood sugar imbalance. These people don't tolerate sugars and carbs so well. But the reality is if you've had a blood test and you know that, your blood sugar's high, or you eat carbs and you feel heavy, you put on weight really quickly, probably not good for you. But even if you're expressing this right now, you can change your environment, you can change your diet, you could start doing some exercise, you could change the way you live, and you would be able to change your phenotype. So I want you to know that your phenotype is what you're expressing right now, and often we think of it more as just our physical and characteristic sort of traits like the eye color, etc. But it's also, do you have a diagnosis right now? Do you have, a cardiovascular disorder? Do you have an autoimmune condition? Have you been diagnosed with that? That's your phenotype right now. Do you have high homocysteine levels? So your phenotype is really the difference between health and disease, and this comes back to a combination of the genes you have and the environment, the food you eat, what you're exposed to, and your lifestyle choices ultimately impact your phenotype, what you're expressing, and you're either expressing a healthy phenotype, full of energy, vibrant, the body's functioning well, you're not in pain, you've got energy, or you're expressing a phenotype associated with, illness, chronic inflammation, things like that. So in today's world, it's really common and normal for people to be eating things from a packet, from a tin, that are processed, and often what we perceive as normal and so-called healthy actually doesn't have a lot of the active components of whole foods that interact with our DNA. So when we're talking about that gene environment connection and that phenotype, as I've mentioned earlier, in the modern world there's this gene environment disconnection, and particularly a gene diet disconnection. We are now eating foods that aren't really optimizing how our genes and our cells and our overall, brain and body function. So what's happened in recent years when we consider, how long it's taken to adapt? We have transitioned from whole foods grown in nutrient-rich soil to now being in soils that are less nutrient-rich and actually having more added chemicals. And overall food production, food storage, and all of this has changed. Now, some of these things are great because we have access to food. It's a good thing to have all this food around us, but we have a new challenge now, and that often people are eating too much. Too many calories, even though I'm not about counting calories, too many calories, but not getting enough of the nutrients that they need. So this is a meta-analysis. A meta-analysis is a study that actually looks at lots of studies that have been published in the past, and it's brought together 95 studies, actually 142 published articles, research articles, but based on 95 research studies around diet and vegetable and fruit intake. And what it showed is that if people ate approximately 8 serves of vegetables, that would prevent almost 8 million deaths, from all-cause mortality. I want to tell you that I'm not suggesting we should all eat 8 serves of vegetables. In our healthy aging study last year, which we've had very good results, we had 6 serves of vegetables, and that is quite a lot to get in. And I think when you're eating good healthy food, more than enough to be getting all your nutrients. And you will see here it does kind of plateau out in this graph. This is another study that's looked at fruit and vegetable intake. I'm not sure if you can see my mouse there. I am trying to circle that sort of top left where it says A. You can see fruit and vegetable intake, and what you can see in these graphs is we're looking at total mortality, cancer, cardiovascular disease, respiratory disease, and neurodegenerative diseases. So in this particular study, they have looked at these outcomes, so these diseases and health outcomes in relation to fruit and vegetable intake in almost 67,000 women from the Nurses' Health Study and just over 42,000 men from another study. They used a validated food frequency questionnaire. So this is where you sort of mark down how many times you eat certain foods, how many times you eat, apples and rice and da-da-da. I used to use the same food frequency questionnaire when I was doing my research, looking at genes and diet in that sort of fertility space. And they did this on these people, this very large cohort of people, every 2 to 4 years. And during this time, while the study was running and they were collecting all this information, almost 34,000 deaths occurred. Hence, we have this all-cause mortality here. So what they found is that fruit and vegetable intake actually increase serves, and it does plateau out at about 5 serves. So interestingly, other studies that have suggested that more was better, but this is saying that after about 5 you don't get much of a difference most of the time. But we can see here that all-cause mortality definitely decreases with fruit and veggies, cancer, cardiovascular disease, a very big dip. If you look over here, if you hopefully can follow me, I don't think my mouse shows up on this, but it's the 4th one in, respiratory disease. What a big dip with more fruits and vegetables for respiratory disease. And then with neurological disease, if you can see that little median line there, it does sort of go down, but it's quite a varied thing. So lots of things obviously affecting brain health. But we can see, and the whole purpose of showing you this is just that food has been associated with improved health and reducing your risk of disease, particularly when we think about vegetables and fruits. And I say this all to you, and I'm making this clear. You might be thinking, well, I already know that fruits and veggies are good, but you might go to your doctor and say, well, does the food I eat affect my autoimmune disease? Because I said this. I asked my GP, who is a great GP, not an integrative doctor, just a standard GP up here. And I said, do you think my diet has anything to do with my thyroid? So after I had my daughter, I had a little flare with my thyroid, plus I developed psoriasis. And I said, do you think this could be to do with diet? And she just said, no, it's got nothing to do with diet. It's an autoimmune condition. And the reality is, I've recovered both times through changing my diet. And we'll talk a bit more about that as we go through. But there is no doubt that the food you put into your body is going to affect your health, your immune system, your ability to heal. So this is really just to emphasize that there. Another study, this is something that I presented recently in New Zealand, with the focus was more on mental health, resilience. This was something done in Australia, and again, looking at takeaway food, soft drink, fruits, veggies. And what they found is that psychological distress and resilience, so that's what they were looking at, was actually associated with the food, in particular Lower stress was associated with higher fruit and vegetable intake, and more frequent breakfast consumption and less soft drinks and takeaway food. Now, this stuff's not new. There are other amazing researchers, Felice Jacka here in Australia, other research groups around the world showing that food is really important, and the quality of food, the types of food for reducing mental health and chronic disease. Just before we get on to comparing diets, let's talk a little bit about something called epigenetics. I've talked a bit about your DNA, how our food interacts with our DNA, but I also want to talk to you about these things that sit on top of your DNA. So we have these things called methyl groups, acetyl groups. They literally sit on the DNA and they act like a switch, turning genes off and on. So epi means on top of or above, and think of it like an extra layer of information. So I've told you you've got this instruction manual. Yes, you inherited your DNA code from mum and dad, but not only did you inherit that DNA code, the instructions, you also inherited this little extra layer that sits on top of that DNA double helix, and that's known as epigenetics. Now, your DNA doesn't change, but your epigenetic code, these little tags that sit on the DNA, can change depending on diet, trauma, exposure to chemicals and toxins, exercise, sleep. So really all of these lifestyle things can have a big impact on our epigenetics and what genes are going to be turned off and on. So when we think about foods that can really support our epigenetics, not just our DNA code, think about a lot of those brightly coloured fruits and vegetables. When we talk about blueberries being antioxidants, it's because they contain things that literally go in and turn on certain genes that act as antioxidants. Broccoli, we can see here, your greens, your cruciferous vegetables, as we call them, broccoli, cauliflower, Brussels sprouts, they have things in them that can actually help with hormone metabolism and, detoxification as well. So our food has all of these compounds. And when you hear, eat the rainbow, that's because we're getting to these phytonutrients, these phytochemicals that literally go in and talk to your DNA or affect what genes are being turned off and on. So it's so much more than just calories. Your food literally interacts with the DNA that you have inside you to make you healthy and well. So continuing on with these sort of bioactives and things in our food that can literally turn our genes off and on, there are things in soy. You've probably heard of resveratrol. When we're sort of drinking our red wine, we're like, oh, there's resveratrol in this. This is, good for healthy aging, good for balancing blood sugars, helping with, lipid metabolism, cardiovascular health. Well, that's the resveratrol, the compound in the skin of those grapes. There's things in green tea. I mentioned the cruciferous vegetables, so sulforaphane, and then, minerals can, interact with certain genes, antioxidants, and turn on these things. If you're wanting to know a bit about this slide, I won't go into it in too much detail, but all of these things are pointing at something called DNMT, if you can see that there. That's DNA methyltransferase. So they're activating a certain enzyme that goes in, changes these little things that sit on the DNA, and that literally impacts the genes that are being turned on. So there's something called methylation. If you've got questions about that, please ask. I love talking about methylation. So my research was in not just genes and food and how they talk to each other, and I was methylation as well. So these things that sit on the DNA. So my sort of expertise is in not just looking at our genetics, but also our epigenetics. And believe me, the last 10, 20 years, the research around this has absolutely exploded. And if you're interested in the healthy aging space, reducing your biological age, those tests are actually measuring these methyl groups sitting on the DNA. But again, just showing you some of these foods. You've probably heard about curcumin as an anti-inflammatory, and if you haven't, it's often given as a supplement because we know, like omega-3s, curcumin can have very anti-inflammatory properties, helping deal with pain and inflammation. So these are compounds in our food, and the way that these foods, which often are turned into supplements, by the way, they're actually, bioactive things found within the food that literally go in, change, these epigenetic tags, molecular functions, and as I said, talk to your DNA. So if you're eating processed and packaged foods that has had a lot of nutrients taken out, that's been sitting for a really long time, added some preservatives, flavors, or processed to the point where it's just removed a lot of the nutrients, when you're not having these whole foods and fresh foods, you're often not getting a lot of those bioactive compounds. So just talking about a diet in general and epigenetics. I won't spend too much time here. My first 10 years were in this preconception, fertility, pregnancy health space. And there's often a lot of emphasis on the mother and the mother's diet, with the health of the pregnancy, with the health of the child. But we now know too, it's, obviously the father provides 50% of the DNA, sperm and egg come together. But as I said, we don't just inherit the DNA, we inherit these epigenetic patterns, and they are directly influenced by the food you eat. So if a male is having a so-called westernized diet with junk food, beer, soft drink, etc., they have an obese phenotype. Remember I said the phenotype is what you're expressing. Are you obese or are you, fit and lean? So they've got an obese phenotype. There's these epigenetic changes associated with that, and these can actually impact epigenetic patterns on those sperm cells, and these can be passed on. So I want you to know that these things I'm telling you are not necessarily just about keeping you healthy. These are important things for future generations as well. So if you're listening to this and you are at the time in your life when you're thinking about having children, or you will be in the future, just know that it's very, very important, the food that you're eating, if you want to set that baby up for lifelong health. Not just as in health of the pregnancy, these epigenetic changes impact metabolic disease. So not just obesity, but type 2 diabetes, cardiovascular disease, etc. Obviously, we've got here the opposite. You can see over here on the right, we've got, they call it harmful and safe. Mediterranean diet, lots of colored fruits and veggies, all those bioactive compounds that are really good for turning on all the genes to help clean up all the waste in our body, keep us nice and healthy. Olive oil, good fats. They've got a lean phenotype. They're going to be passing on better epigenetic patterns, things sitting on the DNA, have a healthy liver, healthy microbiome, and that will then impact that future child. So every day you have the choice to nourish your body and promote health and vitality. And if you're in a state where you're not well, you can start to undo that. You can always make changes to help you feel better. I'm not saying in this masterclass that by changing a few dietary things, you might recover immediately from an autoimmune disease. It's not always that simple. And if you are in that place, you probably need to dig a little deeper than just doing this masterclass. But this is an amazing foundation, because if you understand the power of food, it actually then helps you with these decisions, because you want to put the good things in. But the opposite to that is, every day you could be putting things into your body that actually are causing you to have a buildup of waste products, causing some damage to your cells, not giving you all of the nutrients that you need to thrive or get well. I want to quickly touch on calories. Now, as I've mentioned, I'm not about counting calories. I don't usually give people a diet and say this is how many calories you want to have per day, but I do think it's worthwhile having an idea of the amount of calories you might be consuming, particularly if you are on a weight loss journey, just to find out, are you having a high amount? Are you eating not enough? But I don't want the focus to be on calories. And I think if you truly want to find the right diet for you long term, to get well, to feel good, to age well, whatever it may be, you want to focus on healthy food and not calories. Now, this is an extreme example, but just to highlight the point, if you're thinking about calories and you are, say, tracking your food and the focus is on these numbers, you might actually be missing out on key nutrients that are going to give you energy and act as cofactors for enzymes and help your skin and help your brain and all of these things. So when we compare a 100-calorie apple that's got phytonutrients and phytochemicals in the skin and vitamins and fiber and minerals compared to, say, a diet soft drink that doesn't have any of those things, there really is no comparison. So trying to choose whole foods, real foods, rather than going for low-calorie foods, particularly if they are a bit more processed and man-made. So let's get into comparing diets. Firstly, why do we eat? Well, aside from hunger and boredom and social reasons, the reason we eat is because we need macronutrients, micronutrients, and all these powerful things in food to keep us well and healthy. So with our macronutrients, and our macronutrients are the ones that give us energy, calories, as I explained, but they're a lot more than calories. We've got carbohydrates, proteins, and fats. So with our carbohydrates, they often contain lots of fiber. So these are whole grain carbohydrates, more whole food carbohydrates. Lots of fiber, vitamins, minerals. Our proteins, these break down to amino acids. Amino acids are the basic building blocks needed to sustain life and make muscle and enzymes and things like that. When I explained the DNA code, your recipe book, the instruction manual, remember that's just the instructions. They need to be read and turned into proteins, things that do work in the body, and that requires amino acids. So we definitely need protein. And if your goal too is to put on muscle or not lose muscle as we age, you definitely want lots of protein. And then we have our fats. So our fats actually have the highest content of energy per gram, but they also contain lots of good things essential for us to be truly well and healthy. Fats are absolutely critical for brain health, for our cell membranes, but also we have fat-soluble vitamins as well, things like vitamin D, A, K, etc. And also just quickly with our fats, there is a big difference, just like with carbs, on the type of fats you can eat. So there are very healthy fats, monounsaturated, polyunsaturated, so avocado, olive oil, and omega-3s from oily fish, etc., nuts and seeds. But then there's also poorer quality oils that sometimes are more refined or that have very high levels of omega-6, and the ratio of omega-6 to omega-3 is really important. In the Western diet, we tend to have a lot of the processed foods that are really high in omega-6, and this is what we call pro-inflammatory, causing inflammation, triggering a lot of things in the body. So we definitely want to be having more of these so-called healthy fats and definitely lots of the omega-3s. And when you're eating a whole food diet, and grass-fed meats, things like that, you're going to be getting more of those omega-3s, less of the omega-6s, and that is more anti-inflammatory. So we've got these macronutrients that give us energy, so our carbs, proteins, and fats, but obviously contained within those, it's not just about the calories. We have these vitamins and minerals, and these are known as micronutrients. In Australia and New Zealand, we have the healthy eating guidelines, which you can see here. So we've got this graphical representation. We also have recommendations around, servings. So we're told that it's best to have 5 serves of vegetables, 2 serves of fruit for overall health and well-being, reducing risk of chronic disease. And the reason I mentioned some of those studies before and emphasizing this is because studies show that majority of Australians do not get 5 serves of vegetables per day. And if you think about veggies and serves, it's not actually that much. Half a cup of cooked vegetables is 1 serve. So to get 5 serves throughout the day isn't too much of a stretch. And then 2 serves of fruit. And then we've got our whole grains, dairy, animal products. But looking at the energy intake, what you can see over here on the right is that our guidelines suggest that we should get most of our energy, and remember our macronutrients give us the energy, most of our energy from carbohydrates, next it's fat, and then the least amount, 15 to 25% from protein. So this is not just about energy intake, this is actually taking into consideration the micronutrients that are available in these foods. So to get the nutrients you need to improve your health. So as I mentioned, most Australians don't meet these guidelines. If people just ate a little bit less takeaway food, maybe more water, less soft drink, a few more serves of veggies, the reality is their health is likely to improve. But what you are here for is to work out what is the best diet for you. And there may be other diets that are more suited based on the goals that you have and really optimizing your health. And I'm going to go through those diets with you now and help you understand the difference between, say, our standard guidelines and common diets. So the paleo diet, it's kind of gone out of fashion. It used to be talked about a lot, but a lot of people still eat like this. This is higher in vegetables and meat, moderate nuts, lower in the grains. So if you are looking at that energy breakdown from the standard Australian guidelines, the paleo diet actually has more energy coming from protein and less energy coming from carbohydrates. The paleo diet also recommends, removing sugar, processed foods, and there is some evidence that a paleo diet might actually help overcome some chronic conditions and improve metabolic health. The Mediterranean diet, I'm sure you've heard about. We definitely have the most evidence for it being beneficial to health. But as I said, there's likely other factors aside from the food. But when we think about the Mediterranean diet, different to paleo, which has got more animal foods, the Mediterranean diet is a lot more plant-based. They get a lot more of their energy and nutrition from whole grains and legumes. So things like lentils, chickpeas, beans, etc., things like that. So they're using a lot of legumes, a lot of beans. And when we're thinking whole grains, what's different between a Mediterranean and the standard Australian diet? Because the energy breakdown is probably similar. But these grains are often, particularly when we think about these little villages, think about the blue zones, people having a longer health span, improved longevity. They're often growing these fruits, vegetables, grains in their garden, and they're making the pasta at home. They're making the pasta sauce. They're making their own olive oil. They're picking the olives off the tree. They're making their own red wine. So when we think about the processing of the food, it is very different in some of these cultures and places compared to Australia. We have the ketogenic diet. This is a very low carbohydrate diet, so even stepping it up from paleo in that it's more sort of animal based and definitely much higher fat. So with the paleo, you're getting more protein, less carbs. The ketogenic diet, you're getting a lot more fat, more protein, and a lot less carbs. Now this pyramid I'm showing you on the right is giving you a bit of an indication, but just know that these are general ways to explain the differences in the diet. With paleo, sometimes someone might have a slight variation. When it comes to the ketogenic diet, if someone is working with a practitioner because perhaps they're having seizures, the ketogenic diet does have good success in helping manage seizures, reduce those. It's a really low carb diet, trying not to go over 5% in most cases. And then we move on to plant-based. So vegan diets are definitely becoming more popular, and often this is not just about wanting to avoid meat. It actually goes beyond that in wanting to really take care of the planet and the reducing the cruelty to animals, making sure that animals aren't being exploited. So trying to change the way we do things. And I think there will be more of that as time goes on, not just in relation to animal cruelty, but even in the way that we treat our soils, our oceans, looking after, our food crops as well. People are becoming more mindful, more aware. that we do need from a sustainability aspect, and also just to take care of the planet, because when we take care of the planet, we're actually also taking care of us. So when you eat these foods that have been perhaps not looked after so well, high stress, given antibiotics, given growth hormones, or sprayed with certain chemicals and toxins, in the end that affects our health as well. So it really is a good thing to be very aware of where your food's coming from, and I think there is a massive movement around that, which is really good. The thing with vegetarian and vegan diets, though, is there can be healthy vegans and vegetarians that are getting a lot of, their nutrients, vitamins, minerals, phytonutrients from all these different colored, vegetables, fruits, proteins, fats from nuts and seeds and legumes. But there can also be others that are having a lot more carbohydrates, like processed carbs, packets of chips, crackers, processed, non-meat things, and that can come with a lot of consequences as well. I wouldn't call that a healthy diet when there's lots of processed foods. So when I'm talking about the health benefits of diet, I'm talking more about, the whole foods, and getting back to what I said at the start about the macronutrients and micronutrients. What you want to be focused on is how can I get the best nutrition for me with a diet that aligns with my values, my culture, my goals. So look at all of these and go, well, that's a diet that would work for me because I actually really do enjoy meat, or I don't want to eat meat because of this, that, and the other. I do want to actually have extra protein because my goals are to put on muscle, or I do want to have a more Mediterranean style diet because that's, in my culture. I'm from Europe, it makes me feel better, all of these things. So thinking about what works for you. Lastly, I just want to mention the FODMAP diet. So this is an elimination diet where you take out foods that are potentially triggering gut symptoms. So FODMAPs are fermentable oligosaccharides, disaccharides. So these are, carbohydrates, monosaccharides, and polyols. These particular carbohydrates, like fibers, actually absorb water and can ferment in the colon, and some people get a lot of bloating and pain. Having a low FODMAP diet has been shown to be really beneficial for those with IBS and a lot of gut symptoms. It was developed here in Australia by Monash University. It's used all around the world. The point I want to make is that this diet, like all elimination diets, is not meant to be a diet that you stay on forever. It is so important that if you are doing an elimination diet, I suggest working with a practitioner or understanding that you really do want to bring foods back in to work out which ones you can tolerate and which ones you can't. Ideally, when you remove a lot of these foods, inflammatory foods, things that are triggering you, you get some gut healing so that you can then go on to tolerate more foods. You want to be getting in as many good foods as possible to get all of those nutrients. You don't want to be on a restricted diet forever, because I'll go through the limitations and benefits, but it's definitely something to be aware of, because some people jump into these things and then they're on this, can only eat a certain amount of foods, and that is definitely not what we want. So when it comes to comparing diets, if you look at this table here, we can see there's a number of diets over on the left. Mediterranean, DASH, which was designed to bring down hypertension, a low sodium diet. Paleo, plant-based, low carb, high fat, so similar to a ketogenic diet. So we can see all of these diets here. Mind you, when I was just going through diets, I didn't talk about DASH. I was going to mention carnivore, which is a step up from sort of ketogenic, all animal foods, higher protein. But in the essence of time, I'm trying to bring together some main ones. And really the point I want to show you is the differences in these sort of energy breakdowns and the type of food. So you can see these contrasts and help you understand, what you think could be good for you. But getting back to these comparisons, we have these diets on the left, and what you can see up on the top is inflammation, glycemic control. So this is talking about your blood glucose, and lipids and apolipoproteins. What we are comparing is these diets and how well they perform in these areas. We've got high sensitive HS-CRP. C-reactive protein is an inflammatory marker. It increases in the blood when there's inflammation. Same with interleukin 6. It increases in the blood when there's inflammation. So the number is actually not about that marker getting higher. The number you can see in these columns, the higher the number is actually telling us that the diet is performing better in relation to these categories like inflammation, glycemic control, and lipids, cholesterol. So if you see a higher number, that means it is better. It's better at bringing down inflammation. It's better at helping us manage our blood glucose. It's better at balancing our triglycerides, cholesterol, and lipids in the blood. What you can see is that across the board, the numbers are quite different. And just to summarize, I've put it here for you, and it shows that the Mediterranean diet was likely the most effective for lipid improvement, which is interesting because some studies will tell you that a vegetarian diet, which is a plant-based diet was included, is the best for managing cholesterol. So a little bit of conflicting evidence there. It suggests that a low-carb, high-fat diet, so more so that ketogenic diet, paleo type, but this is ketogenic here because we are comparing with paleo, is likely to be the best for glycemic control. No surprise, you're really bringing down, the carbohydrates, which gives us glucose. And a paleo diet was likely the best for inflammation. Therefore, no dietary pattern performed consistently across all of these categories. So can you see where I'm going here? How can we have one single diet for everyone when there's conflicting evidence out there? In some aspects, the diet might be really good, but also for someone who does or doesn't want to eat meat, a diet or it doesn't fit with their spiritual beliefs, their cultural beliefs, or even just their lifestyle, we really need to consider what you need and what is best for you. So when we look at all of these diets, what I want you to be aware of is that there is some similarity even between a good quality vegan diet and a paleo diet that's higher in meat. When people are starting to have a diet that is more whole foods and healthy, what they're doing is they're eliminating sugar. They're eliminating processed foods, often taking away foods that might be triggering some gut symptoms. They might be getting more nutrients in. And this is then associated with improved cellular health, talking to your DNA, changes in epigenetics. And this is why someone might say to you, I've gone paleo and I feel amazing. And someone else says, well, I've gone, vegetarian, but I feel amazing. It's because there has been a shift. And yes, they're very different foods, different composition when we're thinking about energy intake. But the reality is they're dropping a lot of those foods that are actually potentially causing them harm, like sugar, the processed foods with chemicals, toxins, additives, etc. There are limitations, though, to most diets, and you need to consider this. And as I've said over and over, you need to find a diet that works for you. Just because someone says, the paleo diet's the best, if that doesn't work for you, then that doesn't work for you. Don't go and eat a diet that doesn't align with who you are and what you believe. When you do go, particularly with restrictive diets, you have the issue of nutrient deficiencies. You don't want to be removing foods for too long. If you are doing a vegetarian or a vegan diet, it's really important that you are matching certain whole grains, with legumes and beans to get complete protein. If you are taking out foods, big macronutrient groups or, certain foods with micronutrients, you need to be smart about that if you are going to limit your intake of certain foods. Honestly, variety is the best, but on some occasions you might have a limited diet and you need to think about that. If you really do want to thrive, you do really want to have the best diet for you to be as healthy as possible. The thing about with diets, particularly restrictive diets, or even when you start to get really focused in on food, is that can actually be a trigger for eating disorders. So of course I want you to be thinking about eating healthy food, doing what's good for you, for your body, possibly the next generation, but don't become too obsessed. And if you are going down the path of quite a restrictive diet or even a difficult diet, ketogenic diet is not easy to stick with. It's good working with a practitioner. getting some blood markers, having someone to check in on you just to make sure that you are implementing that correctly, and that you are, not having any of these sort of side effects, nutrient deficiencies, or even leading into an eating disorder. One of the most important things, and I haven't mentioned this yet, but just as important, if not in some ways maybe more than just getting all the nutrients you need, is having a good relationship with food. Enjoying food, celebrating food. Most of us have been there. If you haven't, good on you. But where we've had a bad relationship with food. There was a time where I definitely deprived myself, thought of food as good and bad. I had a terrible relationship with food, and that causes stress. That is not healthy. That no doubt was part of my path, even though I thought I ate well, into getting an autoimmune disease. I definitely was a little bit too obsessed or stressed or anxious about the food I ate. You want to have a good relationship with food. You definitely don't want to punish yourself because you ate something that you think isn't good for you. In addition, particularly with restrictive diets, again, food sensitivities can get worse with long-term elimination diets. It can change your microbiome. You can start to have issues, with the gut. Again, thinking about working with a practitioner or really checking in with yourself, and that diet is working for you. I quickly want to go over genetics and food sensitivities just before we bring this together at the end, because this is important if we are thinking about the right diet for you. Some of us genetically will be sensitive to lactose, therefore we want to eliminate dairy. So there's primary lactose intolerance. This means there's a genetic cause, it's inherited, or there's a secondary lactose intolerance. And that means that it's not genetic, it wasn't inherited, but something has happened. Maybe you've had a gut infection, maybe there's been a developmental issue, you were born early, or there's been cancer treatment, things like that. But if you do have IBS, ulcerative colitis, Crohn's, things like that will damage the gut aside from infections. When it comes to lactose intolerance, we can see that in different areas around the world, there's different sort of frequencies. So some populations will have very high lactose intolerance. They haven't had that gene change. They haven't adapted. There hasn't been an evolutionary step where a genetic variation has occurred to allow them to have what we call lactase persistence. So just to step back and explain lactose intolerance, it means that you are not producing an enzyme known as lactase that breaks down the milk sugar lactose. So what happened many, many, many years ago when humans started domesticating cattle and consuming more milk and cheese and dairy, there was a genetic variation that in a gene called MCM6 in Scandinavia, the UK, Northern Europe at first occurred. We can see that when you trace back to genetics and look at these things. There was a genetic variation, and that triggers the lactase gene to keep producing lactose into adulthood. So it's what we call lactase persistence. These people can tolerate lactose throughout their life. So all of us can actually tolerate lactose, milk sugar, when we're born. Our first food is milk. But then as we wean, and generally by the age of about 2, we're no longer producing, well, if you don't have these genetic variations, you no longer produce that enzyme lactase, and people become lactose intolerant. So if we're just looking at this picture here, the countries that have the darkest blue, almost purple, these are countries where there is high levels of lactose intolerance. They haven't evolved or adapted and domesticated cattle and not having a high intake of dairy. Whereas we can see, this lightest colour up here, it was Northern Europe, so the UK and sort of Scandinavia, where this domestication of cattle first occurred. And this is really going back to the very beginning when I was talking to you about adapting with our environment, being suited to certain foods, certain environments. This is a clear example of that. And just probably don't need this much information, but even though I've got in Africa, they're likely to be from this food intolerance network. This is sort of older data, but in Africa, there is actually a bit of an anomaly that there are these tribes that do show they have lactase persistence. They can tolerate dairy, but they actually do intensive cattle farming. So there are these little pockets in Africa. Interestingly, it's not the MCM6 gene, that's what changed in the Europeans. It's actually a different genetic variation that allows them to continue making these lactase enzymes. So possibly a bit much information there, but just helping you understand the genetic aspect of this. I've just put this in here. One of the first things people say to me is, if I can't have dairy, how do I get calcium? You don't need to go through this in detail. You've got the slide, but during the Whole Food Challenge, to give you a heads up, if you are thinking about getting that, 4 or 5 weeks of nutrition coaching, with me, we do remove sugar definitely for the whole time, but we trial going off dairy and gluten for a couple of weeks, because for some people it's really helpful. You then introduce it and see how your body responds. But the first thing people say is, how do I get my calcium? You can get calcium from other foods, and this is a handout that we provide. So there's lots of resources in the Whole Food Challenge to help you along the way and make sure you're getting all of your nutrients. There is no doubt that gluten sensitivity and celiac disease are becoming more prevalent. So there has been a 5-fold increase in the diagnosis of celiac disease since 1975 in the US, and it is increasing in Australia as well. Now, whether that's because diagnostics are getting better, people are now asking more questions, or if it's changes in our food supply, the health of the gut, we don't know what the cause is, but it's definitely becoming more common. When it comes to gluten sensitivity, there is celiac disease, which is an autoimmune condition, meaning the body is mounting an immune response, making antibodies, trying to attack that gluten. That can ultimately damage our gut, particularly the villi in the small intestine, which is really important, actually essential for absorbing all of our nutrients. So with celiac disease, that damage caused to the gut means that these people don't absorb their nutrients, and they often become nutrient deficient. That can cause anemia, links with osteoporosis, all sorts of conditions. So when it comes to celiac disease and gluten sensitivity, the classical symptoms are gastrointestinal. Often there's diarrhea, but there are lots of other symptoms that I want you to be aware of. So if you're not sure if you react to gluten, know that it's not always gastrointestinal gut symptoms. I don't have gut symptoms when it comes to gluten, but I definitely am sensitive to gluten. So there are other things that can happen. So there's this dermatitis here. We can see I actually was diagnosed with psoriasis, but I now know it's a type of condition that has been linked with gluten rather than just sort of a blanket name, psoriasis. But some people will actually get neurological problems, brain fog. They'll have gluten and they can't think. They'll have gluten and they're extremely tired, or they'll have gluten and they start getting pain, in their joints. So being aware that foods, not just gluten, can cause a range of different symptoms, and we need to check in with those when we are trying to develop the right diet for us. And what I want to tell you too is, if we are removing foods that are causing symptoms, like I said before, we want as many different foods as possible. You don't have to eliminate that food forever. Eliminate it, you're feeling better, then bring it back in. If you've got symptoms, take it back out. But sometimes you'll then be able to tolerate those foods, or maybe you find that you can tolerate a little bit. This is not my finger, but I'm showing it to you because I had exactly that. I had no idea what it was. I thought I had little pimples, so it started out with a few little pimples, also on one of my big toes, the big toe on my right foot. A couple of these little pimple things that were quite itchy. This manifested into my skin just peeling off, to the point where I was no longer able to really use my hands. I had to wear gloves. I also couldn't put my hands in water. I couldn't wash my daughter's hair. So this was, post baby number 2. It also came in conjunction with a thyroid flare. Looking back, it's no surprise. I was breastfeeding. I was traveling internationally, doing talks, just back in action, thinking I was super mum, and the reality was it was too much, and my autoimmune stuff came back. But this time, not just thyroid, and what I thought was psoriasis, but definitely this exact same condition here. This is how it started. Not knowing there was a link with gluten or how serious it was, I didn't change my diet straight away. I thought, I've just got these itchy dots, and even though I was prescribed cortisone, I didn't take it at the beginning because I thought, I'll get over it. I actually thought it might have been dairy. We know that dairy tends to give, acne and rashes and respiratory things, and I was having a lot more dairy. I don't usually drink milk. I don't actually like it, but I was craving these things and having a lot more dairy. So I put it down to that. However, it was really gluten, and when I cut gluten, that really made the biggest difference. It was a long road to recovery. I have no issues now, but if my hands start getting itchy, I know that I need to look at what's going on. Am I having too much gluten? Am I not sleeping enough? Is there too much stress going on? It's often these combination of things. So I do have the gene for gluten sensitivity, and that gene is the human leukocyte antigen, HLA gene. So I have these variations that mean that I am more susceptible to celiac disease and being sensitive to gluten. So if you have these genes like I do, it means that there is the possibility that you could develop celiac disease, but if you don't have the genes, you'll never become celiac. So you need to have those genes because they're what react to the gluten, mounting that immune response, causing that tissue destruction. Just quickly too though, even if you've got the genes, I want you to know it's not diagnostic. It doesn't mean that you will definitely have celiac or become celiac or react to gluten. Remember back at the beginning of the talk, it's the genes, the environment, your phenotype. Are you, someone that's dealing with some kind of, skin condition, dermatitis, psoriasis, you're expressing that there's a problem with my genes and my environment. There's a disconnection resulting in some symptoms or, being sick or a diagnosis. So it's the genes and the environment. Now, in some cases, people will not have those environmental triggers and they may not ever have any of those symptoms. And in some cases, you might develop the symptoms like I did, but if you can work out what those things are, remove the triggers, put the things in you need to heal. So aside from obviously being a bit reactive to gluten, I really needed to sort of up my nutrition while my baby didn't sleep very well at all. I wasn't sleeping. I said breastfeeding, traveling, all sorts of things. So, putting the good things in to heal, removing the things that are triggering you. So when it comes to celiac disease, most patients are diagnosed in childhood, but there are many people that are undiagnosed. And as I said, the prevalence is increasing. So it does seem to be that more people are being diagnosed, but it's likely that has something to do with the work of Alessio Fasano, who I've referenced here, who I had the pleasure of speaking with, not last year, but back in 2022 in London at the NMI, Nutrition Medicine Institute Symposium. So he is our absolute world leader, expert in gluten and how it affects the body. So he's a medical doctor, but doing lots of research, and he has shown that even in people that do not have celiac disease or gluten sensitivity, meaning that they get, the joint pain or the skin stuff, whatever it is, so they're not reacting to gluten. But even if they're not showing those signs and symptoms, gluten in everyone actually does cause an increase of something called zonulin. Now, zonulin increases these sort of tight gap junctions in our gut. So when we think of our gut, it's actually, we kind of need it to be sealed because we're bringing in all of these foods and we need to sort of break these foods down, process them. If it's waste, it goes through, we get rid of it, we go to the toilet. If it's nutrients and things, we need them, we absorb them. What happens when gluten comes in is we actually get this increase in these junctions between our cells, and that is known as intestinal permeability, aka leaky gut. So in some people, a little bit here or there, it's fine. It's sort of not really causing any major consequences. But in others, that can be a real issue, particularly if there is sort of more serious intestinal permeability and things are passing through the gut, which should not. For example, food particles, protein. So our body will recognize those things, or our immune system will detect, that's a better way to describe it. Our immune system will detect these things and go, are you a virus? Are you a bacteria, pathogen? I don't know what you are. I'm trying to look at this. I'm going to mount an immune response, and you start getting this sort of inflammation. So things can pass through the gut that should not, and that can cause, issues in our body and definitely trigger our immune system. So gluten in most people will cause a little bit of that, intestinal permeability, as I said. So that's Alessio Fasano. If you're interested in that, definitely look him up. He has really helped, I guess, with the medical world, bringing gluten to the forefront and helping even mainstream medicine understand the significant impact of gluten on gastrointestinal and overall health. So if someone does have celiac disease, they require a gluten-free diet for life. If you are gluten sensitive and you don't have celiac disease, you're not having this autoimmune response, sometimes you can just remove gluten for a while, and then when the immune system calms down, the gut is healed or whatever's going on, you can then reintroduce gluten and you may be able to tolerate it. So now I want you to think about all of that information. Think about the way you react to food, your beliefs, your lifestyle, your goals, and with that, put together a diet that you think is perfect for you. Because there cannot be one single diet for everyone when people have different beliefs, different lifestyles, different sensitivities. How can we say go and have a Mediterranean diet with all these whole grains and gluten if you react to gluten? Our genetics play a role. Your goals, what are your goals? Is it weight loss? Is it put on muscle? Is it recover from an autoimmune condition? Is it just healthy aging? So thinking about what is important to you and how your body responds to food. And the other point I want to make is that your best diet right now, in this moment while you're watching the masterclass, may not be the best diet for you forever, and that is totally okay. Use food as medicine to heal you, but then things can change as your sensitivities change, as your goals change. By understanding the information that I've presented to you in this masterclass, you understand the power of food, and you don't have to stick to one diet forever. Just eating good food, as many good foods as you can tolerate most of the time. So for example, there are times where I've been quite strict with my diet, removing certain things while I'm in a place of healing, or you want to lose weight, or whatever it may be, you change your diet for a little while, but then you find that place, that happy medium, and hopefully stay with that. Or when life changes, it throws curveballs, there's high stress, perhaps symptoms and signs come back, you then need to change your diet just to ensure that you're giving your body exactly what it needs to help tolerate these outside things that are going on. So just a little bit about the whole food challenge. What we do is educate you about whole foods. There's recipes. If you want to plan your meals, you can. You don't have to. Really, the importance is just being there as a group, getting rid of sugars, getting rid of processed foods. We have weekly group coaching to ask questions. Also, if people are struggling with things or motivation, getting through all of that. We talk about what's involved in a healthy plate. We talk about chemicals and toxins. We talk a lot about gut health, prebiotics and probiotics. A lot of people that do this do have gastrointestinal issues. And just to show you, this says last year, actually this was 2022. We didn't run it last year. I was focused on the healthy aging study, which I will mention. Everyone that completed the whole food challenge reported having more energy. 88% they had better digestion, almost 88% said they had dropped a few kilos, 67% had a reduction in symptoms, whether that was fatigue or pain, and over 60% had reduced stress. Just talking about the healthy aging study. So last year we didn't run the whole food challenge. The year was taken up with this biological aging study. And I just wanted to talk to you when we think about diet and long-term health or just taking care of yourself. This is one of my clients, actually the mother of one of my clients who works with me through her daughter. She's actually the oldest person who did our healthy aging study last year. So she was 82, or she's 82 when she did this second test, and her intrinsic age, her biological age, is coming in at 67. It's amazing. So when she started the study in April, if you can see that there, April 2023, her biological age came in at 72. So she was 10 years younger. Now, I just want to let you know that's actually a big deal. What you want to aim for if you are doing these biological aging tests is to get to 7 years younger. That's associated with a 50% reduction in all-cause mortality, chronic disease. So that's, that is sort of the gold standard if you talk to the company that develops this test, True Diagnostic. So Anne, and it's fine, her daughter Grace is happy for me to use the results, but Anne already came in so much younger, and I wasn't sure if during the healthy aging study we would see a difference, but actually in 3 months, this is the beginning, this is 3 months after the protocol, and I'm waiting any day as we speak to get these 6-month data as well. So we ended up extending this study for people that were interested to get at the beginning 3 months and 6 months. So just to give you a bit of an idea about Anne, so she is extremely active. She goes for little jogs each day. Her diet is fantastic. She does take supplements. She's been checking in with me through her daughter for probably close to 10 years actually. Grace is one of my early patients when I moved from research into working in the clinical setting. Grace was referred by her GP to me for some hormonal things and doing genetics, and then since then, once that was all sorted, she just checks in for healthy aging. So they both do regular testing. Obviously the genetics doesn't have to be done again, but some bloods, maybe hormone testing, stool testing, things like that. So this is someone who is actively taking care of themselves. And I want to say this is all through diet, lifestyle, and a few supplements. None of the crazy stuff. If you're into biohacking and reducing biological age, you'll see there's some people out there spending millions doing crazy things and, gene editing and injecting plasma. It's none of those things. This is just a healthy lifestyle. And I want to tell you about this just because I think nutrition really is probably one of the biggest factors, sleep and stress and movement, but, having a healthy diet, making sure you've got adequate nutrition is so important and honestly can reduce your biological age. So the thing with this study, a little bit different to the whole food challenge, we're focused on food and everyone should be food first, is we did add some key supplements, things that tend to decline with age, particularly focusing on what's known as the mitochondria, so our little batteries and energy. But if you do the whole food challenge and you've got questions about this stuff, we can chat about that, or even in next week's Zoom call. If you are coming to the Zoom and you're watching this live, there will be a Zoom call. If you're watching this later, at a later stage, feel free to let us know if you've got questions and we can respond to those even if you don't make it to the Zoom that's following up with this masterclass. And if you're interested to know about my biological age, my results were not as good as Anne's. I'm showing you quite an extreme result there. I actually came out biologically older, which was disappointing, but expected. I've had Graves' disease. That's associated with accelerated aging. I've had a few bouts of autoimmune conditions. I've overtrained in the past. Probably didn't eat, without a doubt, when I used to train at a really high level. Wasn't eating to nourish my body. Wasn't getting the nutrients I needed. I've lived a colourful life, and although I've been very focused on nutrition, going out pre-children on weekends, not sleeping, drinking alcohol, all of these things that really don't increase health span and do catch up with you over time. In addition, caring for, or, the passing of both my parents has taken its toll on me. My mum with Alzheimer's, and then with my dad more recently. And actually the healthy aging study came off the back of me thinking I might have lost my health in 2022. I could feel that I need to get back on track. And despite having all the knowledge in the world, sometimes taking action can be difficult. So I came up with the healthy aging study. There were multiple reasons why I did it, but one of the driving factors was I knew I needed to take care of myself, because I thought that I might actually have another autoimmune flare. I was definitely concerned about that. So not only was I able to get my health back during that, I reduced my biological age by 3 years, which is probably a little bit more when we're looking at the participants in the study. Most people, it was a few years, which is still significant, not as much as Anne. But I want to make that point too, if we're talking about something like the Whole Food Challenge, this is something that can help you wherever you're at your journey. If you are eating a really poor diet, then you're going to see massive changes. But if you're like me and you've actually got good knowledge of nutrition, you know what you should be doing. Sometimes we just need to refocus back because life has pulled us in a different direction. We've been caring for a parent or a child, or caught up in a new job, or running a business, or whatever it may be. We have lost the focus on what we should be doing, and sometimes we just need to bring that back. And having something like a Whole Food Challenge or a group program where you've got that extra support and it's at the front of mind can be really, really helpful. So here we are at the summary. What I want to say, and I hope you're not disappointed in this, is that I am not here to prescribe you all the exact same diet. That would be crazy, and I hope that that is crystal clear at this point in the masterclass. We are all different. Yes, we want to, in general, have good food most of the time. That's what the Whole Food Challenge is about, dropping these nasties, sugar, additives, and then seeing how we react if we take out some of these inflammatory foods. But it's working with you and your unique needs to develop the best diet for you. What I am here to do is to inspire you, is to show you firsthand the improvement that food can have on your health, on your well-being. And I am telling you this as a geneticist that understands how food interacts with your DNA. This is not just about losing a few kilos. This is about giving your body what it needs to heal and to thrive and to live a long, healthy life, or potentially set up improved health for your future child if you're at that stage. What I want to do is educate you on food and help you connect with yourself. Not only is there this gene-environment disconnection, I think a lot of us are losing touch with who we are and just coming back to our beliefs, listening to our body, and giving ourselves the food that we need to feel fantastic. I want you to celebrate food, celebrate life. It's not about being deprived. It's not about being on a really restrictive diet. Okay, you might need to be for a little bit of time to heal, but overall, the long-term goal is to enjoy good, healthy food, and that you love that food because you know how good it is for you, and you're not tempted by these other foods because, one, they make you feel crappy and you know that firsthand. Or on the odd occasion, you do have a moment where you have something you love, and that's fine because you genuinely want it. It doesn't happen all the time, and that is totally okay as well. So I invite you to come along and join me in the Whole Food Challenge if you want that group supportive experience. If you think that you do need to improve your nutrition and you want that extra support, that is going to be running from the 29th of January 2024 through to February. If you're watching this later and the Whole Food Challenge has finished, let us know if you want to go on the wait list. We'll run it again probably closer to the end of the year. And on that note, there is also a live Q&A coming up next Friday, or this Friday, the 19th of January. That is with a Zoom link. So if you registered for this, you will get an email with the Zoom link and we can have a chat. You can ask me questions about diet, about this masterclass, or if you're still unsure about the Whole Food Challenge, feel free to ask me any questions and I can help you understand if it's the right fit for you at this point in your life. So thank you so much for your time and attention. I hope this was really helpful and I wish you a life of health, happiness, and celebrating food.